microphones. And if you have any questions or comments, please type them into the chat box. If you have questions for specific presenters, also just make sure that you mention the presenter, and then we will ensure that they respond to the questions when they are done. Now, we have two presenters today who are going to take us through the webinar. James Ilam is a senior lecturer in the Department of Primary Care, in the Primary Care Directorate at the UCT. He's also the chairperson of the Public Health Association of South Africa Special Interest Group on Climate and Health. We have Ahmed Makopo, who is an African regional divestment campaigner at 350 Africa. It's an organization that supports grassroots activists running their own independently, loosely affiliated organizations and campaigns to advocate for meaningful change on climate change. Now, before we begin, before James begins, just a quick word. Before COVID began, we already had a climate crisis. And there is abundant evidence that the climate crisis affects public health. We've seen a lot of public health emergencies which are a result of the climate crisis. We know that air pollution kills millions of people per year. We are aware that the many climate and environmental catastrophes that have occurred in the last 10 to 20 years have caused a lot of loss of life. These are issues of public interest. So the webinar today is presented by the Public Health Association of South Africa in conjunction with the University of Pretoria. We thank you for participating. Ensure that if you want CPD points, there's a link on the chat box there that you need to click so that you can fill in your details. That is for only the people who need CPD points. Now, before wasting more time, I'm going to introduce James so that he can start by introducing us to the issue before us today. Thank you so much. James, it's up to you now.
Right. Good morning, everyone, and welcome. Thank you for being part of this webinar. So as Tawanda has said, I'm the chair of the Special Interest Group on Climate, Energy and Health within PHASA, and I'm going to be sharing a presentation with you that you should be able to see now. And in this presentation, I'm going to be looking at some of the reasons behind the, if I can just get my shift up here, right. So in this presentation, I'm going to be saying something about the Climate, Energy and Health Special Interest Group and the work that we've been doing around engaging health sector partners to advocate for healthy energy policy, to prevent climate and air pollution related diseases, and also to promote approaches for healthy living. So we established ourselves as a special interest group within PHASA, and I think it was 2016. And since then, we've been part of efforts to mobilize the public health community. And in a presentation to the parliamentary committee, we brought these key messages: that energy is a major public health issue, that human health is the bottom line of global climate change, and that a just energy transition to renewable energy will both improve public health in South Africa and mitigate global climate change. And what the COVID pandemic has done is just to highlight the urgency of that energy transition and the need for that as part of a just recovery from the pandemic, which Ahmed will tell you more about after my presentation. So just to start with the headlines around the fact that energy is a major public health issue. This infographic comes from work done in 2016 by Mike Holland, an expert on air pollution, who looked at the economic and health-related costs of air pollution from Eskom's coal-fired power stations, which are clustered within the Mpumalanga Highveld area. And you can see from that about 2,200 deaths per year are estimated due to causes such as ischemic heart disease, strokes, deaths from lower respiratory infections, lung cancer, and chronic obstructive pulmonary disease. It also has a huge morbidity burden in terms of cases of chronic bronchitis in adults and children, and asthma symptoms, and hospital admissions, and lost working days. And so the total costs associated with these impacts exceeds $2.3 billion per year. In 2019, March 2019, the Saturday Star reported on the latest Greenpeace analysis of satellite data, which looked at, again, the Mpumalanga Highveld as a pollution hotspot. And Greenpeace claimed that it was amongst the most polluted areas in the world. There was some dispute around the use of satellite data versus ground level data, but the facts are contestable that it remains a highly polluted area. This is despite the fact that in 2007, government promised to clean up air pollution on the Highveld by declaring it a priority area under the Air Quality Act. And yet, a decade later, this report by the Centre for Environmental Rights, in collaboration with Groundwork and the Highveld Environmental Justice Network, showed that toxic air pollution continues, that the efforts to reduce air pollution had failed, and that the air quality monitoring system was dysfunctional. The challenge to provide transparency on energy decisions continues. So this is a very recent news report on the CR website, where Groundwork and others are challenging the decisions within the 2019 Integrated Resource Plan or Energy Roadmap to continue with coal-fired power stations, and providing reasons for that, which are at odds with moves worldwide to move towards renewables, which are cheaper, obviously healthier and more sustainable. And so because of the failure of the Minister of DMRE to provide a response to their call last year, they have until, I think, this week to provide a response to that court action. So the second main point we make as an energy health special interest group is that health is the bottom line of climate change. This diagram comes from the 2015 report of the Lancet Commission on Health and Climate, and essentially what it shows is that what goes up in the form of greenhouse gas emissions that warm the climate comes down in the form of multiple impacts on the environmental determinants of health. So our oceans, the increase in temperatures, altered rainfall patterns, sea level rise, extreme weather events. All of these we have seen increasing as a result of global heating and changing in climate patterns. And at the bottom there, you can see some of the main impacts that were unpacked in the Commission report. Impacts on undernutrition, on mental health, as people's livelihoods are affected as they're forced to migrate, on cardiovascular disease, respiratory disease, primarily from air pollution, and then harmful algal blooms, vector-borne diseases, all of these as ecosystems are altered and biodiversity is lost. And of course, the pandemic is an example of a zoonosis that has been a result of disrupted ecosystems, and we will talk more about that a bit later. So this diagram from the CDC just illustrates the climate health connections. So we have there in the center of that circle the impact of global heating on rising sea levels, increasing carbon dioxide levels, a powerful greenhouse gas, rising temperatures and extreme weather in the form of storms and floods and hurricanes. And so each of those impacts, extreme heat, air pollution, changes in vector ecology, has impacts on human health. And South Africa in recent years has experienced many of those. We've had the water crisis in the Cape. We've had the flooding that we see periodically. We've had drought. We're now experiencing, like many, the impacts of COVID-19. And the air pollution, as I've mentioned, has a major impact not only on those living within the Mpumalanga Highveld area, but also up to hundreds of kilometers away as the wind carries the pollutants to heavily populated areas in Gauteng. In December last year, over 11,000 scientists from across the globe published a paper in which they declared climate change a global emergency. And it was one of the strongest statements to date of looking at the last 40 years of how, as you see in these diagrams here, we've seen increases in carbon dioxide, methane, nitrous oxide, all those powerful greenhouse gases. We've seen reductions in the Arctic sea ice, the Greenland ice mass, Antarctic ice mass, and glacier thickness. We've seen increases in ocean heat content and declines in pH or increasing acidity, sea level rises. We've seen more and more areas being cleared by wildfires or for agriculture. We've seen extreme weather events. So there's this clear correlation between human activity and the climatic response. So this led the world scientists to declare climate emergency. It followed the declaration of climate emergencies by countries around the world. And amongst the prescriptions that you see there, replacing fossil fuels with renewables, reducing climate pollutants or greenhouse gases were very prominent. The just energy transition, which is the third main point that we believe will improve public health and mitigate climate change, was well captured in this report last year by Project 90. And in it, they speak about the need to shift from dirty and harmful fossil fuels to clean, affordable, and sustainable renewable energy, along with energy efficiency. And the reason it's a just transition is that it needs to be done in a way that empowers workers and communities, that shifts the ownership of energy from the current highly centralized one that is prone to corruption and profit-seeking, and that we also need environmental justice. We need to restore areas that have been degraded by decades of pollution of air and water by coal-fired power stations and the associated mining. And we need it to be done urgently so that people's jobs are, who are invested in the coal industry, that people are able to be reskilled and as many jobs as possible being preserved in that transition. And this is what we're seeing worldwide, this energy transition taking place, and South Africa presently is currently ill-prepared for that transition. And so Ahmed will speak more to that as part of the just recovery. I just want to highlight here a letter that we wrote last month to the Minister of Health. We also wrote to the President, and we copied the Minister of Environment, Forestries and Fisheries, calling for public health leadership in building a post-COVID-19 South Africa. It was a sequel to a letter we wrote last November, before the pandemic, where we emphasized the need for action because of the injustice of climate apartheid in South Africa. And in this letter, we also called for the terms of reference of the Presidential Climate Change Commission to be shared with us. We pledged our support, and we asked for the Minister of Health and his officials to be involved in the work of the Climate Change Commission. We were informed that the terms of reference were being prepared, but it seems they still aren't available. And so this is an area for continued advocacy. As a matter of interest, our letter was acknowledged by the Ministry of Environment, Forestries and Fisheries, and you can read more about it in this article in the Saturday Star, but we've yet to receive an acknowledgement from the Minister of Health. And so we will be discussing our options further on that. And then just to conclude, the WHO Manifesto for Healthy Recovery from COVID-19. This has appeared at the end of May. Had these 6 prescriptions, which are unpacked further in these action points for healthy recovery from COVID-19. And in each of those, it emphasizes the importance of mitigating air pollution, which causes 1 in 8 deaths globally every year. It talks about the importance of the healthy energy transition and the fact that there's been an energy revolution taking place that some governments have embraced quicker than others, and ours government sadly has not been one of those. And then it also speaks about the importance of promoting sustainable food systems that are less carbon intensive, healthy livable cities. We've seen, as a result of the lockdown, a massive reduction in air pollution, which the governments now are acting to ensure that that continues. And one of the ways in which they've done that in cities around the world, like London and Milan and Paris, is to open up far more areas to pedestrians and cyclists. We can maintain social distancing while getting around and avoiding public transport. Public transport in our cities are dysfunctional. In Cape Town, it's probably about the worst it's been for decades. And so I'm part of a group working to promote bike lanes as a post-COVID response within our city. And then stop funding pollution. So this refers to the massive tax subsidies for fossil fuels that have been making fossil fuels unrealistically competitive. And so calling for reinvestment in renewable energy is a win-win for our health and our economies. And so you can read more about the detailed actionables for each of those prescriptions at that website. And this healthy recovery has the support of thousands of health professionals around the world, including our South African Medical Association. There was a webinar ahead of the G20 finance ministers meeting mid-July to chart the path forward. And the G20, as you can see there, does include South Africa, and it includes other prominent polluting countries like China and the US and Brazil. And so, again, public health professionals are speaking out. So at that point, I will thank you for your attention, and I will stop sharing my screen and hand over to Ahmed to continue. Thank you.
Great. Thanks so much, James. And Tawanda, thank you so much for having me share the report that 350.org worked on this platform. My name is Ahmed Mohopo, and I am a campaigner with 350.org in South Africa. I work on climate finance and also divestment issues, so really trying to push money away from the fossil fuel sector towards cleaner energy alternatives. I'm going to share my screen now so that I can get the presentation started. I hope you're able to see the screen. Tawanda, could you indicate whether folks can see my screen?
Ahmed, it's not coming through yet, so maybe just present again. Go to present now.
All right, let me try that again. Let's share that.
I'll tell you if it's coming through, when it's coming through. Perfect, it's coming through now. Over to you.
Great, great, thanks. All right, I'm just waiting for it to load. So I guess what I'll start off with while the presentation loads is that at the beginning of the global outbreak, 350 Africa, along with the Climate Justice Coalition, and the Climate Justice Coalition is a grouping of unions, NGOs, and community-based organizations organizing around the climate emergency and calling for climate justice and a just transition, decided to commission this study around going back to normal and imagining a just recovery for South Africa. So in the presentation, I'm going to cover the context around why we decided to commission the report. I'll then unpack 6 pathways that the report sort of puts forward to reformulate, as a way to reformulate the South African public and economic policy. And then I will then highlight some key messages that are coming out from the report, and then wrap the presentation up with some next steps around how you can sort of like help us in ensuring that we're able to maintain momentum around the report, and also as well as just get involved in some of the work that advocacy organizations are doing in South Africa. So at the beginning of the global outbreak, 350.org, together with a large group of allied organizations, put together 5 principles for a just recovery that any economic relief should follow. And the 5 principles are, as you see them there, put people's health first, no exceptions, provide economic relief directly to the people, help our workers and communities, not corporate executives, create resilience for future crises, and then build solidarity and community across borders, and not to empower authoritarians. So given that these are broad global principles, 350.org in South Africa and the Climate Justice Coalition wanted to put forward a vision of what these principles could look like for South Africa specifically. Our starting point was that if we are going to recover from the pandemic, then we need to respond to it in a way that would shake up the status quo. So with the report, we wanted to get a firm understanding of the types of concrete policies and economic mechanisms for a just recovery, which would be aligned to these 5 global principles. We also wanted the report to center justice, and this is social, economic, and climate justice, into the conversation of an economic stimulus. So based on this, the analysis in the report is broad enough to apply a just recovery to all sectors of the economy. It also primarily focuses on our energy system and the need to drive a just transition away from fossil fuels. I mean, we all know that COVID-19 and its impacts on the COVID-19, its impacts on the economy and the fight for climate justice need to be addressed together. And this is a call that's being made by the Green New ESCOM campaign, which is a campaign that's been organized by the Climate Justice Coalition, as well as 350 Africa's own public finance campaign, which is calling for the Development Bank of Southern Africa, as well as the Industrial Development Corporation to phase out fossil fuel financing and for them to instead play a more catalytic role in a transition to renewable energy. So the No Going Back to Normal report is about how a different economy could serve and secure human well-being. It shows that there is a clear link between the pandemic and the climate crisis, and that there is value in creating a resilient economy that serves people and not profit. The report highlights the great opportunities for ensuring a just recovery, and it also includes, some prescriptions around the role of the DBSA and IDC, as well as direct state funding in realizing a just recovery. In essence, this is a report that comes at a moment where there are increasing calls for a different response that rejects budget cuts to key social protection services and instead sees public money being spent on a safe and just recovery for everyone. So just to unpack 6 pathways towards what this just recovery could look like, and to give life to the 5 principles that I highlighted earlier, we are saying that the following needs to happen to secure a just recovery from the pandemic. The first one is around reclaiming and rebuilding public services to promote public affluence. And here, we're making the case for an expansion of public services in a manner that is consistent with a decarbonized economy. So, for example, we're calling for increasing investments in public transport and housing, which could have a transformative effect in our society. This could help manage spatial inequality, allowing more people to live closer to where they work, as well as cutting down how much people pay for transport. And this is all a legacy of the racialized geography of the country. So promoting public affluence can ensure that most of the population is able to access basic goods and services in a manner that is compatible with a low carbon economy. And it also would allow us to advance human well-being in South Africa. The second one is around complementing the green economy with the purple economy. And here what we're saying is that a just recovery must respond to the crisis of care work that is being highlighted by the pandemic. And this calls for the prioritization of ideas around a purple economy in parallel with a green economy. And the concept of a purple economy comes out of feminist scholarship and aims to prioritize the value of care work, as well as disrupt the gender norms that surround care work. So this is to ensure that this type of work is paid for and is better valued within our economy. And with all these pathways, what the report does is that it it distills each pathway with short, medium, and long-term policy policies, just to sort of like provide some guidance around how this could actually, how a just recovery could actually unfold. The third pathway is around transitioning to a low carbon energy system. And this is something that 350, a lot of our work focuses on this third aspect. And here what we're generally talking about is that a just transition to renewable energy can bring about public and environmental health benefits, as well as drive climate change mitigation. A transition in the context of an energy system must aim to ensure affordable access to electricity for all households, especially low-income households that currently have limited or no access to reliable electricity. In unpacking this pathway, what the report does is that it highlights the need for a change in ownership patterns. And this refers back to the slide that James shared around Project 90's work on the just transition and the focus on changing ownership. So, and there what the conversation is around is that rather than energy being owned by corporations, the renewable energy sector must be decentralized, must be a decentralized system, that includes ownership by communities, cooperatives, and even households. And in addition, this transition must ensure that communities and industries dependent on coal and ESCOM-related activities are protected and supported in a transition to renewable energy. The fourth pathway is around pursuing structural transformation and not structural reforms. And as you'll see with all of these proposals, they speak to changing the fundamental structure of the South African economy. So talking to the point around sustainable structural transformation, we need to be differentiating it from what the National Treasury typically speaks about when they're referring to structural reforms. So when the National Treasury refers to structural reforms, they emphasize the need for less regulation, cutting of budgets, and policies that are supposedly aimed at increasing investor confidence. So really what structural reform is about is that it's a focus on microeconomic interventions. These policies have not worked to build an inclusive and responsive economy and have actually in some ways further entrenched inequality, poverty, unemployment, and environmental degradation. Instead, what we need is a focus on policies that generate more and better, formal, well-paying and protected jobs. And in doing this, we need to move away from the reliance on commodities and fossil fuel production. And this requires changes to our macroeconomic policies and a diversification of the goods and services we produce, and also how we produce these services, how we produce these goods, and services. The fifth one is around changing ownership structures throughout the economy to change power relations. We know that the current structure of ownership is poorly suited to fulfill social needs. It concentrates power amongst a small group of people. They're able to influence both policymaking and company decisions in a manner that is not always in the interests of the majority of people or even of the environment. Instead, what we need is democratic public ownership to be a part of the solution. This means that assets, services, and enterprises should be held collectively by all people in a specific geographic area. There are various institutional and representative forms that such a shift in ownership can take place. And with this pathway, what we're saying is that a just recovery must begin to change patterns of ownership and control by ensuring that more enterprises, more services, more assets, whether through cooperatives or community ownership or worker control, must complement changes in ownership with increased participation by various stakeholders in key decisions. So really, the push here is to try and limit the power that large corporations have. And that, you know, in talking about this, we're also saying that democratic oversight of the economy must be enshrined, with the end goal being about the provision of goods for society in an environmental and progressive way. And the last pathway, which is around building a new type of internationalism. And here, it's really being cognizant of the fact that COVID-19 has shown us how interrelated our world is, and how a just recovery must reconfigure and not deepen global inequalities that already threaten precarious economic, social, and political environments, especially in the global South. We need to ensure that our COVID-19 recovery policies take account of this and are done in such a way that we forge a new type of internationalism. So restructuring not just domestic, but also international relations of power. And this will be critical in our fight for climate justice, which is not just a South African fight, but a global fight. So financing this recovery, the report doesn't just you know, push out these solutions without trying to talk about how they could be financed. It concludes with a few ways in which a progressive post-COVID-19 fiscal stimulus package can support the proposals set out above. In addition to direct state financing, local development banks and investment corporations such as the Development Bank of Southern Africa and the Industrial Development Corporation can play a greater, more strategic role by reconfiguring their mandates in order to ensure that climate justice, along the lines of the principles that are articulated in the report, are prioritized. The section also calls for a more progressive income taxation and wealth tax, which is also an important avenue of funding. On top of that, changing the structure of our taxation regime in order for it to be more progressive and redistributive will also play an important role in shifting power relations in our society more broadly. So with this report, the main message is that the pandemic is an opportunity to restructure the South African economy to be more sustainable and more resilient, and to prioritize the needs of ordinary people. It also shows that as with the climate and ecological crisis, the COVID-19 pandemic is shaped by a highly extractive economic and political system that prioritizes people over profit. Communities, governments, and citizens must ensure that we do not go back to business as usual, and that the recovery from COVID-19 is a just one. Another key message is that the South African government's rescue package has severe limitations. The increases to social grants has turned out to be significantly less impactful than what was initially announced, and it also has been poorly implemented. And the business support measures are also proving to be insufficient given the scale of the crisis. The third key message is that the response to the crisis and plans for a recovery from the pandemic must be based on a people-centered approach that is designed to overcome and not further entrench existing inequalities. It is important that we leverage this moment to begin to build institutions and social solidarities that can dismantle rather than strengthen the current order. And then the final key message is that South Africa has the opportunity to develop new economic and social policies that are geared towards building a different kind of economy and can recalibrate the system in which we live in order to mitigate the climate crisis, to build resilience against future crises, and also ensure that well-being, including the health of all people, is prioritized. So yep, that brings us to the end of my presentation. If you want to check out the report, you could go to the hyperlink just recovery.co.za. There you'll be able to get access to the report, to a summarized version of the report. It's also available in multiple South African languages. There is also a podcast with my colleague Alex Lanferner in conversation with the report authors, who are Sonia Palazzi and Carolee Osborne from the Institute for Economic Justice. Yeah, that podcast is definitely worth a listen, just to get like a deeper sense of where the report authors were going with some of the proposals that they set out in the report. And then for you to get involved, the Climate Justice Coalition has an art competition which can be checked out at the justrecovery.co.za link. And this is an opportunity for you to get involved in building on a shared vision, for a just recovery from the pandemic crisis. And they're encouraging people to use art as a way of communicating the type of just recovery that they would like to see happening in South Africa. And then just more generally, you can also join 350africa.org's mailing list. You can follow us on all social media or reach out to me, Ahmed, at 350.org, to get involved in our organizing and mobilizing work on public finances, as well as our work around the just transition. And yep, I'll leave it there, and yeah, I look forward to taking any questions. Thank you.
Thank you, Ahmed, and thank you, James. We reached the end of our two presenters' presentations, and we are opening the floor now to questions or comments or any contributions that you may wish to make. So again, be in mind that keep the videos off for now. Type the comments if you need to, so that we can then, the presenters can respond. While waiting for input or any comments or questions, I'll just summarize a little bit the presentations, but I'm afraid I won't be able to do enough justice to what James and Ahmed have presented. So to start with, before COVID-19, we had a climate crisis, and that climate crisis is a public health emergency. And energy is at the center of what we can do to change the trajectory of the climate crisis. We can definitely change, we can go green. There are so many opportunities, and government and civil society and individuals can contribute. Now, one of the worst things about this is that the poor are disproportionately affected. They are more affected than the rich. And what COVID has done is that it has exacerbated those existing inequalities. More people are vulnerable now. The social determinants of health have worsened. People have lost jobs. Livelihoods have been lost. We have data from the HSSR, which shows that the number of people with food reporting that they are now food insecure has increased dramatically due to COVID-19, and we all understand that. And I'm going to stop here because there's a comment from Jenan. I think this is up to you, James or Ahmed, who wants to respond to that. If you can see the comment, otherwise I can read it out to you. It says, regarding the WHO manifesto item, stop using taxpayers' money to fund pollution. At least banks in South Africa are moving in the right direction. And she has given a link to the article. And the question is, so will SA taxpayers now start paying more for Eskom? We know we've been paying more for Eskom. I leave it up to you, James.
Thank you, Janine. Well, yes, we have been paying for Eskom with our health and with our taxes. I haven't read that article, but I do know that the pressure on banks to stop funding fossil fuel is increasing. Worldwide, there's a massive growth in the divestment movement, and the fossil-free South Africa movement that I belong to has been working with asset managers to design clean funds, funds that aren't invested in the Sasols and Eskoms. The idea of shareholder activism is also growing. So there are groups like Just Share that I think would be part of a good webinar to have. UCT as an institution is now looking at a responsible investment strategy. And again, this has been due to pressure over many years from the fossil-free movement. So maybe Ahmed can say more about the Clean Eskom, but it's clear that unless we act now and act soon, we risk losing more in the long run through stranded assets, having coal-fired power stations that one can't get financing for, or that won't have the water that is needed to operate them. Thanks.
Yeah, thanks, James. And I guess just to add to what you're saying, and thanks for your question, Janine. I think, in South Africa, what we're seeing is, as your statement rightfully says, that South African banks are beginning to move in the right direction in terms of phasing out coal financing. I think it's much harder now to get financing for a coal-fired power plant than it was several years ago. And I think that's a testament to a lot of work that organizations, environmental NGOs have done. And one case springs to mind is the coal-independent power producers, Talametsi and Kanyisa. These projects were supposed to have been developed a couple of years ago, but through the work of environmental NGOs as well as community-based organizations, they've really been able to delay the development of these projects. And what has subsequently happened is the banks came out with those statements around choosing not to finance any more coal-fired power stations. However, while banks are slowly beginning to move in the right direction, they still do provide massive funding for oil and gas. And we're now seeing it in Mozambique with the LNG plant. A lot of big banks are involved, as well as the Industrial Development Corporation, the Development Bank of Southern Africa, and the Export Credit Agents, ECIC, Export Credit Insurance Corporation of South Africa, which are public finance institutions. So generally taxpayer money being used to finance gas projects in at least the SADC region. So a lot of pushback needs to happen on that front. And just to sort of like make reference to the Green New Eskom campaign, what that's really calling for is for our energy to remain within public hands, but that it needs to be done in a just way. It needs to ensure that there is a phase out of all fossil fuels. And I would think that taxpayers would not take too much issue in funding renewable energy if that's what the government wanted. I think right now there is a lot of I guess people are disgruntled at the fact that we are paying more for electricity year on year. However, we still have the load shedding issue, and it just seems that we've just reached in some ways an impasse around how we can have Eskom move in a direction that would truly serve people and the environment. And I think there's a lot of work being done to push that. However, there is also a lot of like disgruntled forces who just are tired of seeing Eskom plunder and waste a lot of money that could be used to fund alternatives.
Thank you, Ahmed. And thank you, James. There's a question from Harsha about the existing restrictions. We are aware that companies have shut down and a lot of economic activity has shut down. And that, coupled with the restrictions that have been put on movements and individuals, may have had a positive effect on climate change. We have heard of reports, but can you tell us more? What do you know about this, especially in the South African context? And in terms of implications for a post-COVID era, what does this mean? Does it mean that companies are just going to restart and we start having more greenhouse emissions as we saw in China in February? Or is there an opportunity here that we may take advantage, that governments are learning? James, is this something that you can speak to?
Well, certainly there's a huge opportunity. It's one that has to be seized soon, to lock in the benefits of the lockdown. Otherwise, if we go back to business as usual, we're headed for disaster. In terms of adverse effects of the lockdowns and the measures, certainly the waste production, from PPE and masks and plastic has been massive, and that is obviously a concern that it has set back efforts to try and reduce single-use plastic. And so I suppose the demand for plastic products has driven emissions. The WHO prescriptions, talk about a health in all policies approach, and that is something that each country has to engage with, and to say, if we are really serious about the health of our people, first and foremost, what does that mean in South Africa for our energy policy? That is a real battleground, and it doesn't help that our ministries aren't being transparent with us about the considerations in the integrated resource plan. So it is an opportunity for health workers to keep on speaking out. We know that the voice of health workers is trusted. We've seen the heroic role that they've played in the response to COVID. And so for each one of us in the health sector, we can ask ourselves, how can we use that capital that the health sector has gained through the pandemic response to keep the conversation and the advocacy going around a healthy recovery. Thanks.
Thank you, James. Jenan has shared an issue concerning the gas drilling at Mossel Bay, and I think the opportunity there is that we have a chance to diversify the energy mix. We have a chance to use less coal and use other sort of cleaner forms of energy. And I just want to share a comment from Rico about the evidence of what he's saying there is that if it costs us a little bit more to transition to a greener energy system, the payoff in terms of what we gain from less air pollution will be much better. It will be much better, and it will compensate for that. It may be better for us to pay for that rather than continue causing unnecessary harm to the people. In fact, one of the greatest worries is that we have not captured the total cost in terms of health of air pollution and the use of energy sources that are putting carbon into the air. Ahmed, I need you to quickly discuss the issue of putting people's health, that principle, putting people's health and their rights first, with no exception. So we understand, we all know that the health system in South Africa is not optimal. in terms of how much money we are spending and how much the people are getting from the system. In fact, with COVID, we saw pictures of people lying in corridors waiting for casualty to be attended in casualty. It seems that COVID has worsened that. How do you envision a change after COVID? What can government do? Have you thought about it? Is this something that you can speak to?
Yeah, sure. I mean, I don't think I can speak to it from like an expert level, because I don't generally work on health issues. But I think just in like lay terms, or at least from like a lay perspective, I would say that you know, that principle came out as an immediate priority that governments need to take on as soon as the outbreak, the pandemic broke out. And just in terms of moving forward, and I think it's something that's referenced quite a bit in the report, is really ensuring that we are investing in public services and public goods, and that's where a lot of the focus, or at least government's focus, really needs to go, is in ensuring that we are providing public services to all people. And I think what the pandemic has shown us is that there are many gaps in providing those public services, especially when we're talking about health, and that there needs to be a concerted effort by government to try and improve on its systems. But I can't speak to the specifics around what exactly a future health system could look like. And I mean, I don't know if it'd be maybe worth turning to James to just sort of like unpack further what like a health system for the for the people could look like.
Thank you, Ahmed. So we're running out of time, and James, I need you to also speak to the issue of creating resilient health systems for future crises. And in the context that COVID-19 is not likely to be the last pandemic that we are going to face. We expect probably another pandemic in the next 10 or 1.5 decades. In the next 15 years, there may be another pandemic. What can we do so that the health system is resilient to these crises?
Yeah, that's a good question. So in its manifesto, the WHO does have quite a lot of advisories around the healthcare system. So under the prescription around investing in essential services, they talk about water, sanitation, hygiene, clean energy, and then for healthcare facilities, they speak about strengthening or infection prevention and control in healthcare facilities. And they speak about, obviously, the availability of sufficient and safe water, about accessible and appropriate toilets, safe wastewater disposal, healthcare waste, water sanitation, waste facilities, policies on occupational health and safety. And all of these have long been part of the Global Green and Healthy Hospitals initiative, which is a project of Healthcare Without Harm, an international project for the last 15 years or so. And their 10-point agenda is really about, creating healthcare facilities that help to mitigate climate change through the use of water, waste, and energy, and also make them more adaptable to disasters like extreme events, and promoting local sustainable procurement. And so, I really encourage you to look at the both the actionables for the WHO manifesto, as I referred to, and the Global Green and Healthy Hospitals agenda from Healthcare Without Harm.
Thank you, James. We are running out of time, so I'll just quickly talk about the comments that have been put up there. Rico has just commented that there were no noticeable reductions in particulate matter concentrations. So maybe there were other benefits, but That's what we have there. Ahmed and James, I don't know if you can speak to the issue of the poor, the people. The people are at the center of this. When we talk about justice, just recovered, the people should be at the center. Have we heard their voices? What are they saying? Have they contributed?
Yeah, just quickly, like I think, for example, with the Climate Justice Coalition, they're trying to bring together community-based organizations to be in conversations with unions, to be in conversations with NGOs, and to really try and push collective demands to government. And I think that's what we really are trying to push for in the report, is to really try and advocate for more spaces to allow for more participatory, democratic processes where people are able to sort of contribute, or at least state what it is exactly that they need. Up to this point, we have seen that the most marginalized in our society have not been able to go through this pandemic crisis. It hasn't been easy for them, you know, and I don't think that government is properly hearing them. And so with initiatives like the Climate Justice Coalition, that is a platform to try and use our collective voice to really advocate and push for people to be at the center of our pandemic response. So lots of work to still happen in that regard, but there are initiatives happening all across the country to try and carve out those spaces.
Thank you, Ahmed. Any last words, James?
Just to endorse that, to say that as a special interest group, we have joined the Climate Justice Coalition. We invite people to get onto our mailing list, to follow us on Twitter, to really be part of efforts to engage with the public health community, to show the same leadership in the public health community that we've seen in the pandemic in facing the crisis of climate change and how to make a more resilient society. So for each one of you, I think, you know, there is a lot you can do. And with the recording and the links that will be shared, I encourage you to find out more. Thanks very much.
Thank you, James. Thank you, Ahmed. Thank you, everyone, for attending our webinar. So just a few words, if you still haven't registered for CPT points, the link is on the charts there, so that you can register for the CPT points. This webinar has been presented by the Public Health Association of South Africa. We are welcoming new members, and we'll be glad if you join us. And the special interest group on climate, energy, and health, again, it's part of the Public Health Association of South Africa, and we are looking forward to new members who can contribute. You have heard from Ahmed, and there's so many ways you can contribute to the call for a just and green recovery from COVID-19. Thank you so much. Have a great day, and see you on the next webinar. Bye, everyone.
Thank you very much. Goodbye.
Bye.